Two of the major disagreements when it comes to Medicaid is whether or not states should expand their program or keep it the way it is. It all goes back to the topic of money. The truth is that money runs out, and many worry that their state will lose even more money if their state decides to expand Medicaid. Another big disagreement when it comes to Medicaid is whether Medicaid or Medicare is better. The answer is neither. Different programs are intended for different purposes, so that does not dictate whether one is better than the other. Hopefully this video can help those looking to apply to recognize whether Medicare or Medicaid is the better option to go, or both. Hello people, my name is Jackie, and today I will be discussing the topic that is Medicaid. In order to decide whether Medicaid is the right decision for you, you need to really delve into the pits of the historical background of Medicaid and really understand it for what it is. So it all started on a beautiful summer night in 1945. President Harry S. Truman tried to get the idea of Medicare to pass. However, it wasn't able to happen. One of the factors was that the American Medical Association labeled the president's plan to be socialized medicine, saying that it was taking advantage over the public's concern over communism in Russia. Truman inspired a later president, Lyndon B. Johnson, so much that President Johnson felt that he needed to honor Truman's wish. On March 1st, 1965, the House of Representatives and the Senate passed the Social Security Amendments of 1965, which stated that Medicaid would be the health insurance for the blind, those with low income, seniors, and those that are disabled. This was a step in the right direction, and on July 30th, 1965, inside of the Harry S. Truman Library, President Johnson created Medicare to help the elderly and Medicaid to assist the poor. About the goals of Medicare and Medicaid, President Johnson said, "Not one of these, our citizens, should ever be abandoned to the indignity of charity. Charity is indignity when you have to have it, but we don't want these people to have anything to do with charity, and we don't want them to have any idea of hopeless despair." Although Medicaid sounds like it would be rather simple, it's gotten a little bit more complicated as time has gone on. However, before we get into the nitty-gritty of it all, let's establish what Medicaid is first. Medicaid is a program that provides health care for those with low income and helps make it affordable. Unlike Medicare that is meant for the elderly, Medicaid is meant for those more on the poor side. Another thing that makes it different from Medicare is that there is no age limit. Anyone can apply, only that they need to have less than $2,000 in liquid assets. For instance, a house is an example of something with very low liquidity, so things like that wouldn't count. In order to be eligible, one's family would have to fall under the annual income requirements, which can fluctuate depending on how many people you have in your family. For instance, a family of two would have to earn no more than $15,930 in order to be eligible. So like I said, anyone is eligible to apply. However, children, those who are pregnant, families, those who are disabled, and seniors are more likely to receive it than others. The things Medicaid covers differ from state to state. However, each state must allow the recipients to receive x-rays, hospitalization, laboratory services, or medical or dental surgery. After that, a state can decide what they choose to cover based on the people's needs. Now for the most complicated part. Drumroll. Where do they get the money from? Medicare is a federal government-only program. However, Medicaid is run by both state and the federal government. Because there are two governments in charge of Medicaid, both help pay for it. In order to decide how much they need to pay, the federal government looks at a state's federal medical assistance percentage, also known as an FMAP. This percentage usually lies between the 50 to 83% range, meaning that the federal government pays for 50 cents to 83 cents of every medical dollar, and then the state government pays for the rest. Of course, in the end, all this money comes from taxes. Yay! How fun. So there you have it. That is the lowdown on Medicaid.